Hello guys, this is Mr. Mnyenyembe. So I want us to do neonatal resuscitation. So what is neonatal resuscitation by definition? So neonatal resuscitation, this is just a procedure that is performed to actually support the newborn, the baby who has just been born with difficulties in breathing, or the baby that is having cyanosis, or the baby that is gasping. Okay, so that's the definition. What are the indications of this procedure? So we have conditions like severe birth asphyxia. We have conditions like RDS, which is respiratory distress syndrome. We have cyanosis itself, and gasping, if the baby is gasping. Those things would actually prompt you to perform neonatal resuscitation in this procedure. Okay, what are the principles of this procedure? So you need to have adequate lighting, and you need to make sure that you close nearby windows, and you need to have a watch. So you need to actually have a timer, okay, so that you can time yourself as you are performing this procedure. Okay, so this procedure should be performed on a resuscitator, which we don't have. So I will just show you what to do, the steps that you actually need to follow. So you need to make sure that you switch on the heater in order for you to prevent hypothermia, as you are also close the windows, the nearby windows. Okay, what are the requirements of this procedure? So on the trolley, you are going to find the ambu bag and a mask. Of course, it's supposed to be like this. So you're going to find the ambu bag. So this has to be connected to the oxygen. And you need to have the mask. So this is just one type of a mask. So they are in different sizes, and you just need to connect it there. Okay, so this has to be clean. So we also have the stethoscope, a receiver with the penguin sucker, and we have the guard port with the normal saline. On the bottom shelf there we have hand sanitizer. Okay, we have the baby on the resuscitator, and this side we have sterile gloves. So remember, neonatal resuscitation is not a clean procedure but a sterile procedure, meaning you need to observe sterility, you need to don sterile gloves. Remember, infection prevention issues, you are dealing with a newborn. Okay, so this procedure, you don't have to perform it alone. Yes, of course you can, but you need to have other team members. So what I'm trying to say is you need to shout for help. Okay, so you say help, asphyxiated baby here, for example. Okay, and the team members will come for to help you do this. Okay, so you need to get permission from the mother, of course, the OSPWE, and of course you need to start by washing your hands. Okay, so wash hands and dry them. Okay, so you demonstrate like that to show that you've done sterile hand wash. Then on the field here, you don't have to be talking. Okay, so you dry. Okay, so we've already shouted for help. So you say help asphyxiated baby here, and the two members will come. So after doing that, the next thing you do, you need to dry the baby. Okay, so you dry the baby. You are going to find the baby covered in the receiver and the towel. So the one which will be inside is the one that you are going to use to wipe the baby. So you wipe the baby like this. As you are wiping, you are also stimulating the baby. Okay, so you wipe the baby, trying to stimulate it like that. And then at this point, other babies can even cry. Okay, and there will be no need of you starting to suction and stuff. So this will go down there, and then the remaining towel you need to cover the baby nicely. So you only expose the chest. Okay, remember you have to prevent hypothermia. You prevent the baby from having hypothermia. So the next thing you do after turning the baby, of course, don't forget to be turning the baby the way I've just turned it. Okay, and you need to also maintain that. You need to make sure that you prevent the baby from having hypothermia. So this will remain like this, and we're not going to remove. Okay. So after doing that, you are going to assess. So we started with wiping the baby as well as stimulating the baby. Okay. So after doing that, the baby didn't cry. So the next thing you are going to do is you are going to assess. Okay. So we've wiped, and the next thing is to assess. So what are you going to assess? You are going to look for the respirations. Okay. The appearance, the heart rate, and of course the color of the baby. Okay, so you start with the appearance. How is the baby appearing? Is it pink? Is it blue? Okay, so you are going to say, my examiner, the baby appears to be blue. For the heart rate, you are going to get the stethoscope. You place it there, and then you just place it under the nipple on the left side there. Okay, this side. Then you listen to the heart rate. So if the heart rate is below 100, less than 100, okay, you have to continue with the other interventions. So we've looked for the color, the appearance, and we've observed the heart rate, which is below 100. The other thing is the respirations. Okay, the respirations. How is the respiration? So you have to observe. Then you count the rising and the falling of the chest. So you're going to say the respirations are below 30. Okay, they are below 30 or below 40. Okay, the other things that you are going to look at is the activity or the grimace. Okay, so you try to stimulate the baby, and then you find that the baby is not active. You do that, the baby is not active, it's not crying. Okay, so after doing that, and you can't see any result, the next thing you are going to do, you are going to suction. Okay, so you get the penguin sucker, you place it like that, then you start with the largest cavity. So in this case, the largest cavity is the mouth. So you start with the mouth. So you do that, then you put there. Okay, just use normal saline there to remove the secretions. Okay, then you place it again. You go to the nostrils. So the first nostril suction, put there, you remove. You place it again, then the last nostril. Okay. After suctioning, again you reassess. Okay. After suctioning, you now need to reassess. So you are going to do the same thing. You get the stethoscope. Of course, you start with the appearance. So you are going to say, my examiner, the baby still appears to be blue in color. The respirations, they are still less than 30. The rising and falling of the chest, they are still below 30. The heart rate, do this. You listen to the pulse. They are still below 100. What of the grimacy, the activity? So you try to stimulate the baby is still limp. The baby is not crying. Okay, so what will be your next intervention? Now you are going to try to give the rescue breaths. Okay, you give rescue breaths. So you are going to connect the mask to the ambu bag, which is already connected, and then you are going to give 5 rescue breaths. So you need to make a seal. Okay, you need to make a seal. So you need to do this. You form something like a C as you are holding this, like that. Then these fingers, you support the chin. So you do this. Can you come closer? So what I'm saying is, you make a seal. You try to move the head of the baby like that, which we call chin lift or the jaw thrust. So you do this, then you make a seal. Then these fingers will go below the chin there, and then you make a seal. But make sure you don't cover the eyes of the baby there. Okay, so you do this, then you give 5 rescue breaths. So you go by 1, 2, as you can see the chest there is even rising, 2, 3, 4, 5. Okay, after doing that, you now need to reassess again. You need to reassess. So you're just going to repeat the same thing. So you get the stethoscope. You start with the appearance, which is the color. So I'm going to say, my examiner, the baby still appears to be blue in color. The respirations are still below 30 or still below 40. The heart rate, you do this below the nipple there. Then you listen to the heartbeats. You say they are still below 100. Put it back. Then the grimacy or the activity, you try to stimulate the baby again, and the baby is still limp. The baby is not crying. So what do? You are going to proceed and give 15 ventilations. You are going to give 15 ventilations. So you try to do chin lift again, like that. You make a seal again. So you do that. Make sure that the nose and the mouth are inside the mask there. So you do that. Then you make a seal. Then you start giving 15 ventilations. Other books, they say you give 30 ventilations or even 40. So you give 15. So you go by 1, 2, 3, 4, 5, 6, 10, 12, 14, 15. Okay. So after doing that, you repeat the same thing. You are going to get the stethoscope. You start with the color, the appearance. The baby still appears to be bluish in color. The rising and falling of the chest, the respirations are still below 30 or below 40. The heart rate, you listen to the heart rate, which is still below 100. For the activity, you try to stimulate the baby. The baby is not crying. Okay, and the baby is still limp. The reason why you have to call for the other nurses, the other team members, so that you resuscitate the baby. As you are giving the vents, someone has to be giving CPR there. Okay, so you go by 1, 2, 3. Okay, so you go 1, 1, 2, 3. You give. Let me just show you. You hold the baby like this. So someone is going to hold the baby like this, and they are going to use these thumbs. So just below the nipples, they'll do this, and then they'll start doing CPR like that. I'm sure you can even get the sound there. So they'll go like 1, then you give 3 ventilations there. 1, 2, 3. 1, 2, 3. 1, 2, 3, just like that. So let me just demonstrate. So you go by, say, so you make a seal here. So you go, you give 1 vent, like 1. Then someone is going to do what I was just doing. They'll give 3 compressions there. 1, 2, 3. Then you give 1 vent. 1, 2, 3. So now, during OSC, since you are going to be alone, so you make a seal, okay, like that. You do chin lift, then you give 1, and then you are going to do it alone, since you'll be alone. So you are going to give 1, 2, 3, like that. Then you give 1, then again you go by 1, 2, 3. Okay. So you do this at least 3 to 4 times. Okay. Then you put it back, and now you reassess. So you are going to get the stethoscope like that. You start with the appearance, which is the color. So you say the baby. This time you're going to say the normal sign. Okay. So you're going to say the baby now appears pink. Okay. The baby appears to be pink, or the baby is now pink. That's the color. You try to listen to the heart rate. You are going to say the baby's heart rate is now above 100. The respirations, you are going to say the respirations, of course you need to observe. So you're going to say the respirations are now regular. Okay. And lastly, you talk about the grimace and the activity. So you're going to say the baby now, the baby is active, is able to respond, and the baby is now crying. Okay, so that means you have resuscitated the baby because it has now cried. Okay, so what you are going to do, you are going to cover the baby nicely since it has cried. Okay, you are going to cover the baby nicely. The baby is crying, and you are going to give it to the mother for kangaroo care. Okay, and to promote, of course, bonding between the baby and the mother. So you give it to the mother, and she should also breastfeed the baby. Okay, so you give it to the mother. Okay. After doing that, you need to dismantle the trolley. Okay, and of course you have to remove grabs. You have to remove grabs. Excuse me. And you end the procedure by always doing hand washing. So wash your hands for the last time. Then you say, I'll document and report to the ward in charge that neonatal resuscitation has been done on the baby, and the baby has cried. Okay, so that's what you do about this procedure. If you have questions, you can ask me questions on the comments there, and I'll be able to respond to you. Okay, so thank you guys. Let's make sure that we continue following. Follow, share to your friends for you to actually continue receiving my videos. Okay, so for now, cheers.